the differences when it comes to symptoms between stomach heat and stomach fire according to Chinese medicine. What are the treatments, best acupuncture points, formula, food recommendations, and what are the Western disorders that have stomach heat or stomach fire as their main pattern of diagnosis? What are the causes of stomach heat and stomach fire according to Chinese medicine? I'm going to talk about all of this and so much more today to really help you clear out the differences, but also how to treat it, how to look at it from a perspective of Chinese medicine. Welcome back to my channel. If it's your first time here, I'm Clara from AcuPro Academy, and I create Chinese medicine and acupuncture content for students and practitioners, making it easy to grasp and fun to learn. This is the fun today. I decided to film outside, so you might hear the birds, the rooster, the dog barking, but hey, let's make it fun. It's a beautiful sunny day in British Columbia, Canada. Let's go. As I said in my introduction, I'm going to differentiate stomach heat versus stomach fire because my students ask me that question all the time. Of course, both of them are excess heat or excess yang in Chinese medicine. However, there are a bit of differences. Fire is much more worse than heat, which makes sense, right? So both of them are going to have stomach qi rebelling with some heat symptoms. So let's look at the common symptoms, then we'll look at the differentiation between the two. Both stomach heat and stomach fire have acid reflux, acid regurgitation. They both have bad breath, thirst for cold drink, and they pretty much gulp all day long because that's excess heat, right? They may have insomnia if they eat too much. They also have constipation, tendency to feel hot all the time, specifically after a meal. And they have full rapid pulse and a red tongue with a yellow coat. Oh, and I wanted to add that both have red lips because the stomach opens into the mouth and reflects on the lips, right? So red lips is excess heat in that instance. They also have burning sensation in the epigastrium area. What are the differences? Fire, as I said at the beginning, much more worse than heat. And so with fire, there's usually bleeding, which means there could be vomiting blood. There could be canker sores that are bleeding in the cheeks or in the mouth. The difference between canker sores on the tongue, that's heart fire, and in the mouth, that's stomach fire, because stomach opens into the mouth, but the heart opens into the tongue in Chinese medicine. See, looking back at foundation always can help us figure out everything. So when it comes to stomach fire, mouth sores, which can be bleeding, also maybe vomiting blood if it's really bad, or bleeding gums. And the tongue with stomach fire would be very cracked because there's so much fire that it dries the fluid. So it's still red, there'll still be a yellow coat, but it would be really cracked. Does that make sense? So that's the differences. However, they're both excess heat, excess yang, and they both have that stomach qi rebelling affecting them. What are the common Western disorders associated with stomach heat, stomach fire? Heartburn, acid reflux, GERD, hiatus hernia, indigestion, peptic ulcers are probably the most common one. And what are the causes of stomach heat, stomach fire? Medication, diet, of course, a lot of spicy food, acidic food, coffee, alcohol, emotion, specifically anger, irritability, fear, and stress can really create that liver qi stagnation, overpowering, over-controlling stomach, creating stomach qi rebelling. Makes sense, right? Lifestyle like smoking, obesity, anybody that's really overweight may have a lot of pressure on the stomach area, and that may create some stomach heat, stomach fire. Also during pregnancy, because the Chong and the Ren can be out of balance or not harmonized, and that can create some nausea, vomiting, but also a lot of heartburn that's very common with pregnant women, right? So drugs can do that as well. So there's a lot of causes, and sometimes we can manage those because we may not be able to remove them, for instance, the pregnancy, but other time we can obviously eliminate them by changing the diet or de-stressing the person, and acupuncture is so good when it comes to de-stressing. And what are the consequences if stomach heat or stomach fire are long-lasting and not treated? Well, they both can lead to stomach yin deficiency, large intestine heat, body fluid deficiency, phlegm fire, which can affect the mind as well. So we need to really address it before it escalates. Does that make sense? So let's look at how we address this pattern in Chinese medicine. Let's start with acupuncture points. The best one to clear heat is large intestine 11. The best one to clear fire is stomach 44. So we can put those two, plus they're both yang min meridian. The large intestine is a hand yang min, and the stomach is a foot yang min. And those are really strong in clearing heat and fire. So that'll be the perfect combo to start with. Then, because it's affecting the stomach, we want to put the digestive commander point, which is stomach 36. We want to put Ren 12 because it's the front mu point of the stomach, or we can put bladder 21, which is the back shoe point of stomach, depending if you want to do a front treatment or a back treatment. Now, when it comes to food, we need to cool that stomach heat down. However, if we cool it too much, we may create some problem for the spleen. The spleen does not like cold. So we have to be a bit more gentle. However, we can use food that are cooling, like fennel, greens, leafy greens specifically, and having parsley juice, cucumber juice, or apple cider vinegar, which is really good. It's calming that stomach acidity, baking soda, and anything that's fermented, like sauerkraut or kombucha. That makes sense? That's the fairy. You know, we're outside. Let's look at 3 amazing tips you can give your patient to support them while they go home after they have treatment with you. 1, they have to chew their food and eat slowly and mindfully, but they also cannot lay down right after a meal. So they should stop eating at least 3 hours before they go to bed. That's number 1. Number 2, aloe vera juice. Very good to alkaline the stomach acidity. So it's a really good, powerful, cooling juice that can help. It comes from the cactus family, right? It's aloe. And it's really cooling. So that helps, but I won't affect the spleen too much. However, I wouldn't overdo it. Just maybe once a day to cool the stomach. And 3, lemon balm essential oil applied on Ren 12, Ren 17, and PC6. Very good to calm that stomach chi rebelling and to cool the stomach heat. Isn't that awesome? So remember those 3 tips so you can give them to your patients and they can be part of the healing process, because we are educators, we are teachers, and we are here to help and support our patients to the best of our ability, always. The spleen and the stomach are opposite, but they work together in the digestive system, right? Like the stomach has tendency to go up, while the spleen has tendency to go down, and where you're fatigued and lose stools. The spleen has tendency to be damp and cold, while the stomach has tendency to be dry and hot. They're really opposite. I would recommend you watch my spleen qi deficiency, causes, consequences, symptoms, and treatment to give you an idea of how to address spleen qi deficiency, which is literally the opposite of stomach qi rebelling or stomach heat. I hope that was useful. No matter what, keep rocking it using TCM, and I'll see you in the next video, maybe outside.